Thank you, Vice-Chancellor, for your inspiring words. Now moving on to the conferment of an honorary degree. The University recognises outstanding individuals who have contributed to society and their professions. We do this through giving honorary awards. Today we'll recognise one of these outstanding individuals. Vice-Chancellor, it was unanimously resolved by the Senate and the Council of the University to confer an honorary degree upon Mark O'Herlihy. Professor Marianne Hardy, Professor of Radiography and Imaging Practice Research, will present the candidate. Marianne.
Thank you. Vice-Chancellor, graduands, distinguished guests, I'm truly delighted to provide the oration today to honour Mark O'Herlihy. Excuse me. Mark is a diagnostic radiographer. Qualifying in 1996, Mark trained and worked in London, specialising in cardiac and trauma imaging. Mark's passion has always been about making a difference to healthcare delivery and the patient pathway. He was one of the first reporting radiographers in the UK and completed a postgraduate certificate in musculoskeletal reporting at the University of Hertfordshire in 2000, before moving north to work in Leeds. At that time, hospital organisations were erecting barriers to advancing radiographic practice, and Mark and other radiographer pioneers were working hard to push through these to develop new radiographer roles and career activities that could make a real difference to patient outcomes. One of the barriers was not recognising awards from other universities as evidence of competence to practice. And so Mark had to repeat his image reporting qualification at the University of Bradford in 2002 to demonstrate his worthiness to report X-ray images. When Mark started his career, radiography used X-ray film, something that UK healthcare students today will only see in museums or on TV dramas. But the digital revolution in medical imaging was beginning, and radiography was moving rapidly to a computer-based technologies, something that healthcare professionals were not yet educated for. Quick to see the need to improve digital education, Mark left the NHS to set up the AGFA Training Academy in Leeds, which provided healthcare professionals with an intensive course on digital image acquisition, data management, data processing, and algorithm manipulation. The fast and widespread implementation of digital imaging opened the door to digital solutions in healthcare and accelerated the adoption of digital data sharing systems. Today, digital healthcare systems, well, at least most of them, interface and interact with each other seamlessly, but in the beginning, each system developed was a unique and effectively a digital silo, and Mark believed that the only way forward to improve patient care and service delivery was to create a truly integrated digital system, and the direction of his career changed to developing digital data systems. Mark spent many years working in different roles for different companies, building on this idea of a unified digital healthcare system, and his work provided the forerunner for today's vendor-neutral archive systems, which basically means the NHS and any other healthcare organisation can change their data management provider without having to buy new hardware, a bit like Apple being told that their phone charging points must now be the same as all other phone providers. Mark credits his ability to see how a system or technology might work to his clinical radiographer background and ability to look at the bigger picture and the potential to influence systems and patients and healthcare delivery. He is able to look at what is and see what could be. And this unique talent for innovating and positive can-do attitude caught the attention of IBM in 2016, who were developing artificial intelligence or AI systems to support healthcare, IBM Watson Health. IBM asked Mark to lead and drive the change globally in this developing market, as the outcomes and benefits to patients would be far-reaching. Mark understood enough about healthcare and imaging to know that the anxieties about AI and what they would bring to the workforce, and therefore the challenge was not to develop the technology, but to educate people in how best to integrate AI technology into healthcare practice. Mark's achievements and influence throughout his career are wide and varied, but at no point did he lose sight of the purpose of healthcare or values of clinical radiography, to improve the health and well-being of every person in society. He is now the Chief Commercial Officer for Circle Health Group, where his innovative approaches continue to drive forward healthcare delivery through the development of personalised digital healthcare solutions to support healthcare decision-making and promote affordable healthcare choices. As a radiographer and alumni of the University of Bradford, Mark's career and contribution to healthcare, business and technology has had a global reach and impact, and represents the core values and missions of the university. His career recognises the fluidity of skills and attributes necessary to make a difference and role models the flexibility required of the agile workforce of today and the potential to influence the future of tomorrow. Vice-Chancellor, for his outstanding contributions to radiography, healthcare innovation and delivery, I have great pleasure in presenting to you for the honorary degree of Doctor of Health, Mark O'Herlihy.
By the authority vested in me, I admit you to the degree of Doctor of Health of the University of Bradford. Congratulations and thank you.
Wow. Vice-Chancellor, graduands, family, friends and guests. Firstly, I would like to offer my congratulations to all of you who have achieved this major milestone in unprecedented circumstances. To reach this point today through such a difficult time shows incredible resilience and fortitude and will undoubtedly give you the skills to tackle any challenges that you will face in the future. I would also like to congratulate your families and friends who I know have played a major part in supporting all of you. I'm sure that they are very proud to share this amazing day with you. I would like to thank Professor Hardy for those very kind words on my career. I am truly honoured and humbled by the honour bestowed upon myself by the University of Bradford. I've had the pleasure in completing a postgraduate qualification here under the tuition of Professor Hardy. The lecturers and staff have a deep-rooted culture that focuses on excellence, inclusion, innovation and trust. And this is reflected in the success and long-term development of all students. Today is a testament to that. I would not be standing here if it wasn't for the support of my family, my wife and children, my parents and everybody who has bought into my mission and vision to improve healthcare, outcomes using data and insights. You cannot achieve success alone in any role. That support network is as important now as it will be in the future as you come up with your crazy aspirational ideas. This support network will initially laugh at you, but then they will ultimately support you. I've dedicated my life to healthcare, and to receive such a high recognition of that only gives me more drive to continue to try and make a difference to patients and clinical staff. I first undertook my work experience at the age of 17 in the southwest of Ireland in a pre-digital age, with wet film processing, dark rooms and paper. But I knew then that every person in that hospital had clear goals that inspired me in my career to improve patient outcomes and reduce the time to treat. As my career progressed, I realised that in radiography, I was in a unique holistic profession. I got to help patients in minor injuries, intensive care, paediatrics, adults, cancer care and cardiology. I took part in multidisciplinary team meetings and also helped porter patients, as we all would be doing, and worked with all hospital staff. It was only later on in my career when I started to engage clinicians from all countries and specialties that I realised the foundational experience meant I was impactful, insightful and knowledgeable and could enter into any part of healthcare and life sciences with confidence in my knowledge gained clinically. All of you graduates here are now at the start of your journey. I'm confident you can and will make a difference. Healthcare has a once-in-a-generation opportunity to cure and treat disease with the emergence of DNA sequencing, gene therapy, pharmacogenomics, digital twins, to name just a few. The progress over the last 10 years alone have been incredible. And as you enter the healthcare environment, you'll be shaping and driving forward the next innovations. This is an incredibly exciting time to be in healthcare, as our opportunity for fast progress to a better health and life is now held in data, and we have the opportunity to unlock that and gain valuable insights. I urge you to embrace the large mass of human data at our fingertips now, use it to augment your excellence, and ultimately provide better outcomes for patients and people all over the world. It is customary for me to share some advice based on my career and experiences. If anyone that knows me knows I have a lot to say, I'll try and consolidate my career and experience to a number of values that have helped me along the way. First of all, be mission-driven and don't be afraid to share that vision. The focus is personally rewarding. Stay authentic and true to your values. Be kind and respectful. This will give you the ability to take these careers and work anywhere in the world. Embracing all cultures, diversity of teams and ideas is key. Working globally taught me to listen and learn. It's okay to fail, because failure is etched on the path of success. But one thing you need to be careful of is fail to prepare and then prepare to fail. Challenge the status quo. Because it has always been like that, it doesn't make it right. Be humble in leadership. There is a difference between being a human being and being human. Lastly, I would like to thank again the University of Bradford for this incredible honour and recognition for all allied health professionals, and I'm confident that graduates here today will have been given the knowledge and skills to impact healthcare and better patient outcomes for the future. Thank you.